It's an honor for me to be here. My name is Brenda Aguilera, and I'm the Director of Community Transformation at Para los Niños. At Para los Niños, we believe in eliminating barriers in marginalized communities so that children and youth can thrive, so that families can exercise their full power and potential, and so that communities can be strong and vibrant. While we've been successful in developing and implementing an integrated approach to early and school-age education with youth workforce, family, and mental health services since 1980, by 2009, we recognized that these services were not addressing the root causes of historical systemic conditions that are inherently racist and oppressive. And no matter how much work we do to support a child or a family with resources, services alone, communities are not able to thrive. Guided by this fundamental understanding, the fact that the residents of the communities we partner with are strong, capable, and want the very best for their children, families, and communities, and that the most effective solutions are surfaced by drawing on both their lived experience and expertise, and the expertise of aligned organizational partners, we develop partnerships with residents themselves. Today, we call this Best Start Region 1, a regional and local partnership composed of nearly 900 residents and organizations, elected officials, city and county departments, foundations, faith-based organizations, and businesses who co-design, implement, communicate, mobilize, and evaluate systems change strategies that contribute to the creation of whole child systems. We believe that whole child systems need to be created to truly support the well-being of children and their families by ensuring that systems are accountable, accessible, of quality, aligned, and sustainable. So now that I have shared a little bit about us, I hope that you see why it's an honor to moderate today's conversation on whole child systems. So what do we mean by whole child systems? To ground us on this approach, we define whole child systems as a whole child equity approach that recognizes that a child's well-being is rooted in the healthy functioning of their family community. This approach emphasizes the full scope of a child's growth, learning, and developmental needs, such as emotional well-being, safety, health, and more. The whole child approach examines whether children enter school healthy, learn in an environment that is physically and emotionally safe, have access to adequate nutrition, stable housing, and reliable transportation, are actively engaged in learning and connected to their school community, have access to personalized learning and supports, and are challenged academically to prepare for higher education or a career. Now that we're grounded in this approach, I have the honor to introduce you to our panelists who will now ground us on what this approach looks like in practice and the vision for its full potential. Mayra Alvarez is president of the Children's Partnership. In 2021, she was named by President Biden to the COVID-19 Health Equity Task Force. In 2019, she was nominated to serve on the First Five California Commission and the Early Childhood Policy Council. And in 2017 and 2021, to serve on the California Mental Health Services Oversight and Accountability Commission. Keisha and Nzewi is co-founder of Black Californians United for Early Care and Education. Keisha also serves as the vice president of the Mount Diablo Unified School District Board and is the public policy director for California Child Care Resource and Referral Network. Keisha has enjoyed a social justice-driven career that began as a Vista volunteer in Sacramento. Jackie Thu-Huong Wong is the executive director of First Five California. She brings more than 3 decades of experience working as an advocate for equity, health, and education for children, youth, and families. Jackie currently serves as a trustee for the Washington Unified School District Board and is a professor for Sacramento State's School Nursing Credential Program. And last but not least, Noemi Valdes is the Director of Early Childhood Education Programs for the Oxnard School District. Noemi's career is in education as a bilingual instructor assistant in the Oxnard School District, supporting teachers and students in kindergarten through 5th grade. As an outreach specialist for many years, Noemi provided direct services to students and served as a liaison between school, communities, and community-based services. This panel is designed to be more of a conversation. So I want to invite and encourage our panelists to build on each other's ideas. There are 4 questions for y'all to respond to. You will each have 2 minutes to respond to each question. You will receive a 5-minute warning before the time is up so that we have time to move on to the next question. So I will begin with the first question that has 2 parts. The first part is, from your perspective, what do you envision as the critical elements necessary to design quality whole child systems that are rooted in equity and community power? The second part is, considering the history of how quality has been defined, how can we reclaim the resource quality so that it reflects our community's assets and needs? Who would like to speak on this question first?
I'm happy to start. I can kick it off, and I know my fellow panelists will add brilliant ideas. So first, again, I want to say thank you to Catalyst California for the invitation to join you and to be on a panel with such distinguished partners and really allies in the work that we're trying to do for the well-being of our children across their development spectrum. When I consider this idea of what the critical elements that we need to comprise a whole child system rooted in equity and community power, I think I start with centering the experiences of the families we seek to serve. So how do we ensure that families are central to the design, the evaluation, and the implementation of the programs that we know are intended to serve them? For many of the systems that are supposed to serve our families, whether that's the education system, the healthcare system, or social services system, they were not set up to meet the needs of California's families today. Really thinking about Black and Brown families. These systems were not set up to serve them in the unique way that they need to be served. Knowing that, in order to be more equity-centered, and again, rooted in community power, how do we integrate families and community leadership as part of the design of our programs? So really uplifting community leadership, uplifting cultural strengths, and the numerous protective factors that culture has provided our Black and Brown families across California. And when you say that, how to operationalize that commitment is particularly impactful, to really think about what does integration of community voice look like. From a healthcare system perspective, for example, how can we ensure that we're bringing community leadership into the delivery of healthcare services to parents, to babies, to children? One such example is community health workers and promotoras, and thinking about how we're uplifting community leadership as part of that, and we can talk more about that. I think the second thing is really moving forward community-defined practices, community-defined interventions that center community leadership as part of these systems, all right? And thinking about how is healthcare delivery improved by focusing on cultural practices. For example, thinking about community-based doulas, thinking about healing circles. Those are practices that have long been a part of our communities because they had to be, because our communities found a way to support each other. And now integrating those practices as part of our more traditional systems of care will not only strengthen our systems of care to better respond to the needs of our diverse communities, but frankly also challenge the system to serve everyone differently, and as a result, better.
Thanks for that, Mayra. I wholeheartedly agree. About a year ago, the commission actually adopted a North Star that I really am proud of, right? And Mayra was fundamentally part of that work. That our goal and our North Star is to ensure that belief to create trauma-informed, healing-centered, and culturally responsive systems to address the inequities that we see every day that has built into the racism that has been baked into the systems that are supposed to be family and children serving, right? As Mayra was talking, I've been actually kind of thinking about this a lot in my different conversation, is that when we create policy, we keep on saying evidence-based practices, and really don't unpack what that means and how do we flip the script to make sure that there's practice-based evidence, right? Mayra has listed out a number of things, practices in the healthcare system that is like, again, I would say generations, right? Generations of good practice, yet they haven't met that evidence-based practice. So how do we actually, in the positions that we have, to begin to disrupt the conversation a little bit? Right? Saying, well, like, what is, if we really want to move towards a more just, and again, justice is what love looks like in the open, right? I love that phrase from Cornel West, who has roots in Sacramento. And I know my colleague Keisha will actually talk a little bit about her work and centering around love and justice and families. That is spot on for me. One of the things that we did, and it's the first, and it's crazy to think that we're actually the first in the nation, because we've had multilingual families in this country forever, and that the commission made a huge investment in our what we call DLL pilot. We understand like it's multilingual learner pilot that really centered on the importance of home language and multiple, lifting that up. We understood that in 16 counties, we invested that partnering, just something really as basic as fundamentally partnering with families is a key part of our early childhood development, right? So, and it's an asset. And how do we begin to bring that into our education system, our healthcare systems, our economic systems, that again, everybody, I always say whole entire countries have valued actually more than one language for centuries. And so here in California, why is it that we are the first in the nation to actually begin to invest and really highlight through the support of the ECPC and Catalyst California for kind of really prioritizing multilingualism in early childhood. So.
Thank you, Jackie. We have 5 minutes left. Who else would like to?
I'd love to chime in. To know me is to know that I believe I come from a value and a place of belief that quality, and when we're talking about quality in childcare or early learning, has been co-opted, and it's rooted in white supremacist values. It completely shuns the love, as Jackie just said, the love and care that Black women and other women who aren't white have been providing children for generations, including white children. And so I think about how these women have stayed true to their cultures, and I think they're the OGs of whole child and whole family systems. It's the norm in Black and Indigenous and other non-white cultures for folks to feed each other when they don't have food, or to take care of each other's children, or to take care of their elderly when their families can't, or to take in children when the adults who are supposed to take care of those children can't, to fix your neighbor's clogged sink, to have rent parties, to, as Mayra mentioned, to be doulas or midwives is what I was thinking, to pay other people's light bills. So what we need to do is look beyond white dominant culture, but we're all so used to and is ingrained, to the rich culture and belief systems of everyone else who's been doing whole child and whole family in their communities. And we need to lean into their expertise, and we need to trust their expertise. They need to know what quality is. They've always known what quality is to them, and what that looks like. And it doesn't look like how it's been defined traditionally. So we need to believe them. And then we'll have a whole child systems that are devoid of anti-Black racism, that provides every child and family what they need based on what they said they need, and not what the powers that be said they need. So basically we need to design a whole child and family system with the identified community cultural keepers who lead the way. We on the outside provide whatever's necessary and requested to convene people, to provide research or data or anything like that if people feel like they need that. And more importantly, we pay for it. But bottom line, we just need to respect and believe what the community says they need and want.
Thank you, Keisha. And we have 2 minutes left before we move to the next question. Go ahead, Noemi.
Thank you so much. Thank you again for this opportunity. As you well know, school districts, I'm from representing the school district, and school districts tend to be very complex systems within ourselves. And very frequently, we try to resolve our concerns on our own. But knowing that best practices and quality whole child care systems involve and include bringing in partnerships from the community onto our school districts and helping us as a school district prepare students for their education. Equity is one of the staunch pillars of excellence in our district. And we know that we need to have the collaboration and be a collaborative partner with all of our resources and community resources to prepare our students. In our district, our research tells us that very close to half of the children that enter into kindergarten enter without any preschool or structured environments and experiences. And for us, it's not only the loss of educational experiences, but really early identification. And that's one of my passions, is the early identification and early intervention of services and implementation of services in order to address those concerns before they enter kindergarten and students are ready to learn. We integrate a strength-based approach, which relies heavily on the families prioritizing what their concerns are, helping them identify what their needs are, and then working together with our collaborative partners and resources in the community to provide those services. And this could entail basic needs, to housing, to developmental concerns for their children. So again, we need to be as school districts open to those partnerships and working with our community to prepare our students. That's the whole idea around our whole child care systems, is looking at the whole child, looking at the family and what the family's needs are, and bringing in those community, the power of that community as a resource for our families.
Thank you, Noemi. I'll move on to the second question. How is this vision being reflected currently in the various systems that support families of young children? I could ask Jackie. I see you ready to share.
Oh, that's the magic wand question, right? Is it like, I'm just going to be a little bit bold here, and we're here for a reason, right? If we really truly, if all systems centered families and really understood how to do that, we wouldn't be having this conversation today, right? I have found that oftentimes, for whatever reason, we fund in silos. So we create silos across different systems between education, healthcare, birth, 0 to 3, 0 to 5, 0 to 8. So we actually slice and dice because it makes it easier for the system to implement. But what gets lost is centering the conversations around families. I mean, I am a refugee kid who actually really understood, my family understood that it took the village that Keisha was talking about, right? That it took the church, it took public government, it took government cheese to feed me and my family. It took somebody to try to figure out how to help my family find housing. right? And that was a conglomerate of public-private partnerships, public-private discussions of breaking down and blending and braiding resources and funding, right? So for me, as I sit here with First Five Californians, as we try to move towards that North Star, what are we doing to break down those silos? How can we, the magic of being where we are placed as we are working in between state agencies, right? We get to be the glue that connects and lifts up kind of like the similarities of values and goals, right? So as systems, and there's a ton of money that we got to get out there, a lot of implementation, but and I would say, like, we look at LCFF and education finance reform, and Keisha, I don't know about you, but we're still struggling with what equity means as we kind of totally reform education finance, right? And now we have UTK and UPK, right? And so what can we do? And we had NCLB, and then we had RT, Race to the Top. We had all these acronyms, right, that were supposed to create a just and equitable society for all of our communities. So what can we do to learn from that and say, let's stop working in programmatic by programmatic, and how do we work with one another? I'm excited about the opportunities for community schools, right? And whether or not ECE can be front and center in that space with UTK and UBK. And I'm beginning to have those conversations with, again, it takes a conversation, right? It takes us to look at each other locally and at the state level to kind of sit together and plan together, if you will, right? What can this opportunity with community schools that's coming out of CDE bring to the early childhood space, knowing that it's a lot of work, but also we have, generations and lots of communities behind it who actually can center resources in schools, right? In a really meaningful way.
Thank you, Jackie.
And I didn't mean to be so direct, but it was like, well.
Great. Thank you, Jackie. That was great. Who would like to build on that?
I'll go. My hesitation too was because I'm like, well, but are we like, like, is there a system? Is there current systems that do that in the way that we hope for or imagined? And I would be hard pressed to identify them within the system. And I believe, okay, like, I can't get my words out. I'm sorry. We're very deficit minded. We think that the government is here to save you usually meaning, as Mayra says, Black and brown families, Black and brown children, from yourselves really. And I think about, so if a child comes to kindergarten not having attended a structured preschool prior, we look at that as a deficit and not look at it like, what is all the love and care that they received up until that moment? Because most of us did not, of a certain age, did not attend such a structured program. And here we are attending the, second day of water cooler conference. So we're pretty successful in our lives. And we don't ask the question of what are our systems doing to prepare for our children. We want our children and families to be prepared for the system instead of our systems or this whole child system that we imagine being prepared for them. So I am, again, just hard pressed to identify where we are doing it now as a system. There's examples, obviously, throughout communities, because communities, if we can't depend on anything, we can depend on ourselves. But as a system from within the state, I don't know that it yet exists.
I can build off of Keisha's point and thinking about which system are we talking about here? In particular, when you're thinking about babies and toddlers, young children, which we're trying to talk about as part of this conversation, it is the wild, wild west. And thinking about how families need to navigate those first few years of life, right? For many families, most families, the first system they come into contact with is the healthcare system. So really thinking through how is that interaction with a system the most positive experience for that family in the jumpstart to this incredible adventure that they're about to embark on, whether it's their first child or their seventh. It's still going to be an adventure, and ensuring that that person, that birthing person, has the supports necessary to have a healthy start for themselves and their baby. That is the responsibility of all of us. And so when we think about a system for early childhood, it's really a comprehensive set of systems that need to work together to meet the needs, the diverse needs of families. And I think, and I'm going to talk from the healthcare system perspective, we've been incredibly encouraged at California's commitment to centering children and families in healthcare delivery changes, right? One example is the dyadic care model and thinking about a birthing person and their baby as a unit. Healthcare in our country has been incredibly transactional. It's been, a service that you get paid for and then you're out the door. In a dyadic care approach, you're really thinking about the mother and the baby, or the birthing person and the baby, as a unit and caring for them as a unit. That's something that has been forever as part of our cultures, right? Those first 40 days of life, right? You don't think about separating a mother and a baby or a birthing person and their baby, and neither should our system. Babies don't go to the doctor by themselves. Babies don't go to a childcare center by themselves. So how are we thinking about our families as units in how we pay for delivery of care and how we support our provider workforce in delivering those cares and support services? So that's one example. Another example can be thinking about the whole child and youth behavioral health initiative, right? $4 billion towards children's mental health. And how can we emphasize early childhood mental health, recognizing that mental health challenges show up differently in babies, and that you cannot think about the well-being of a baby without thinking about the well-being of their mother, their father, their family unit, in order to support, their overall health and well-being. And another one is, during the public health emergency, there was something called continuous coverage for multiple public programs. Public programs are intended to serve the public, and yet without the public health emergency, we make families jump through administrative hurdle after administrative hurdle to enroll in the program, to redetermine their eligibility, to prove their income, to show their address. And if they don't, we drop them off the rolls, recognizing that that is a critical lifeline for families to hold on to those public programs. How, as Keisha stated, as Jackie stated, how are we making the systems work better for families instead of putting the onus on the family to navigate that system better? Those are the things that we need to hold our and policymakers that have made these important commitments to kids and families. We need to hold them accountable to it. So while we can celebrate these accomplishments, we are now monitoring implementation to ensure that the promises we say we are keeping for children and families are actually completed as it moves forward. And at the same time, not resting on our laurels, but really thinking about how else are we uplifting community leadership? How else are we thinking about these approaches in childcare, right? How are we thinking about these approaches in housing, in nutrition, in the many different needs that families have in order to take care of their babies? It's not one sector and we check the box and we're taking care of babies, right? It's all of these systems that have to work together in order to comprehensively address the needs of families and put them on the healthiest start possible.
Jackie mentioned earlier the UPK and the UTK system. And so the UPK is the umbrella where it is now an opportunity for systems to be working together. Is it going to happen overnight? Of course not, it's going to happen overnight, but I truly believe this is an opportunity for our communities, including school districts, including all the different resources out there in the community, all of our early childhood education providers, to come together and to work on those systems, to align those systems, to avoid gaps in systems and have students and children and families and whole families fall through the gaps. So I truly believe that this is an opportunity that we all have to relook not only what's happening in the classroom, in the transitional kindergarten classroom, but also what's happening around that student, around that child, and what systems are in place to support students and families. So it really is an opportunity that we should be taking advantage of wholeheartedly, not only school districts, but all the different resources around our community.
Thank you, Noemi. I'll share the third question. how can the state work in partnership with our communities to create aligned whole child systems that build on the number of investments that currently exist? And I think you've all kind of spoken to that. So I want to invite you to maybe share some specific strategies and how that could be accomplished by the state adopting it. And if it's okay, maybe I could open it up to Keisha and then Noemi.
First, I want to say for Mayra, I was reflecting on all the great things that have happened over the years, because I know you, like at the end of every year, you and I get to reflect on, oh, what happened policy or legislative wise. And I'm like the poo-pooer, nothing for little kids. And you're like, but there's great things for little kids, because from your vantage point, there is. And these are the things you just described are so amazing and awesome. And then I always wonder, like, but what about childcare? And I feel like it's like our society's just, I don't know if it's paternalistic or misogynistic view that, oh, it's the responsibility of the mother or the family or whatever. So this isn't something, the role of a system to have to take care of. So it wouldn't be prioritized like healthcare, because we can't take care of, we're not a doctor or a nurse or what we imagine our healthcare, what equals our healthcare system. So that was my aha moment in this moment. But in general, when we're talking about like, what do we need to do? Like, we have to think about like who's actually impacted or included and excluded in the decisions that we make and the systems that we develop, who leads it, and from my point of view, how are the experiences and leadership of Black educators and families a part of that decision making? And the fact is, right now, they aren't. I don't know that we want to build on existing investments because they exclude so many voices in decision making. Government is really good at coming in after the fact and doing things to communities or for communities and rarely with community. And so we need to be intentional and seek out the voices of Black families and Black educators and early educators. The state can do that by first finding and building trust with trusted messengers, both individuals and organizations and community groups that already know what we need. They already know what we need to know. They already know who we need to know. And then the state needs to pay those messengers to engage the folks that they've silenced for so long. In our Black ECE, Black Californians United for Early Care and Education, we have a 10-point policy platform. And one of the policies that we want is for the state to intentionally engage Black parents locally and statewide in any stakeholder group, because our departments are really good at stakeholder groups, in any stakeholder group and locally to make it a requirement that in local efforts that Black parents and families and childcare providers are intentionally engaged in these conversations because they've been silenced for just way too long. And then they just need to take what they learn and do what they say.
Thank you, Keisha. Noemi?
Thank you. In our community, one of the examples of how our partnership with communities, we're using that to create aligned school systems, is working in the area of our extended day programs or extended learning programs. In our community, there is a high need of, we have a very high number of working families in our communities. And so providing before and after school care is very important for our community. And that's the voice that we heard when we survey parents. That's what we hear when we survey communities, our different district communities. And within our district, we're a very large district, and each community in each neighborhood is very distinct, but what they do have in common is working families and the need for care. So we partner with various agencies to provide that enrichment experiences for our students. When UPK came about and UTK came about, the need was also there for our transitional kindergarten students. But the agencies that we were working there with our extended day program were not apt and were not capable and to provide those services for our early childhood education partners, students. So we partnered with our early childhood education programs and community resources, and they are the experts in early childhood education. They are the experts in what is appropriate, what's developmentally appropriate activities and such, and supports for our students. And so we are partnering with those agencies, and some of those agencies we've been partnering for 30 years. They have early childhood education centers on our campuses, so it's not new. They're not new partnerships. So that's on the expanded learning side of the house. As far as providing equitable quality access in our transitional and kindergarten classrooms, we are working with various universities and various agencies to provide research-based, evidence-based practices that provide and extend developmentally appropriate practices for our early childhood education students, primarily in TK, which hasn't been historically routed in the direction that UTK and UPK now calls for. So we're working in collaboration with several partners to really take a look at how do our adults, our teachers, and our systems across preschool, early childhood education, all the way to high school really collaborate. What are some of the high-level pedagogical practices and developmentally appropriate practices that we are implementing in the classroom? So those are the areas that we are looking at this moment. And so again, this is all fairly new, the last few years, but given the direction with this UPK, UTK, this is what we are looking forward to expand on.
Thank you, Noemi. Mayra or Jackie?
I can try to say something in response to Noemi's comment as well as Keisha, and I'll pick up where she left off. And actually, this is to Jackie's opening comments as well. You know, one of the things as coming to this group as a child health advocate, right? That is what my background is in. That is what our organization fights for every day. But when you think about the definition of health, it's a very expansive definition, really recognizing that health is far more than what happens in a doctor's office, but it really is influenced by the community conditions in which our children are raised. So to Keisha's point about what are we doing for childcare, what are we doing for the settings in which so many of our babies and toddlers spend the majority of their day, or almost the majority of their day, you can't separate health from that conversation. So really thinking, how are we not siloing ourselves as advocates when we are all fighting for the same families that are fighting for the resources that they need to help their kids, right? And I, my organization, we really try to challenge ourselves to think about how are we integrating health into these spaces, and how are we showing up in our fight for child health equity in the childcare fight, right? How can we be better partners in that space? Because as we know, families don't have the luxury of siloing themselves off by issue. They can't take care of their kids' childcare today and their child's health tomorrow. They're dealing with all of it at the same time. And that's what that responsibility is on us as advocates too. So I want to say that part first. And then again, to the comments that Noemi just said about, putting the culture and high quality into the classroom from UPK and UTK, where does culture fit in that discussion? And I think one of the things that I'm incredibly encouraged by First Five and its commitment to DLL and dual language learners is, how does culture fit into that discussion? And not just for dual language learners that are part of immigrant families, but thinking about language for Black children as well, and the power of culture in language as part of identity development for our young children, right? The value of language connected to identity development, to recognize their racial identity and be proud of it, is part of mental health It's part of their healthy development as children. And yet we silo it off to think about this as an education issue. No, it's actually very much a mental health and well-being issue as well for our children. So thinking about these investments and the benefits that they will reap, not only for our education system and our future entrepreneurs and workforce, but also for the well-being of our communities. Again, really seeing the cross-sector benefits as a result of fighting for children holistically and not by issue area. So that's one thing I want to say. And then the other thing, I want to really highlight some of our local partners in Los Angeles that have been working on the African American Infant and Maternal Mortality Prevention Initiative. They call it AIM. And this is the leadership of organizations like the Black Women's Health Project and First 5 LA and LA County Department of Public Health. That's really lifting up the leadership of Black women, Black birthing people, in order to connect families to the services that are available to them. Because so many times, or how many times have we heard families, I didn't know about that program, or I didn't know I was eligible for that, or how do I enroll in that? The idea that we can uplift community leaders to connect families to the resources that they have a right to access by leveraging the power of community leaders, to Keisha's point, that's like a no-brainer. Of course, that's what communities have been doing for centuries, is helping people navigate these systems. Again, the onus has been on the individual, but by uplifting this workforce, by uplifting the community organizations that have the trust of community members, in this case, Black families, we are then strengthening the system to better respond to the needs of Black families and other families by learning from this example. And that's LA County, right? So I want to recognize, how can we make sure that wherever a baby is being raised in our state of California, they have access to these types of services and supports? And questioning how we can make these changes at a systemic level is, I think, the next battle that we have to fight in order to ensure that we are prioritizing the well-being of California's children, now and in the future.
Mayra, you stole my example of the DLL and about scaling, and just so proud of the Commission's continued commitment as of last Thursday to really what we didn't talk about is actually integrating from a systems level everything we learned from the multilingual learner pilot, right? Centering in caregivers, centering in communities. You don't get whole children without whole families, whole communities, right? So how do you operationalize that? And how do you scale? When you think about our work with Impact and QCC, and it's not perfect, we know that, right? However, our target was family-friended neighbors and family childcare homes to be part of that conversation, centering in what we know works, valuing the whole child approaches that had been, quite frankly, not something that we invented, has been deep in all of our cultures, as I'm looking at folks on the screen, for generations, valuing how we were raised, what it runs through our veins and our blood, right? And how is, I keep on thinking about this, is that we are responding to a system that was not built for us. Like, I'm looking at the screen going, it was not built for us. It's not built for our communities. And when I say disruption, it's like, how do we begin to kind of flip the values of individualism versus community, right? How do we begin to see one another? I think about this in terms of something we did yesterday. It takes the system to begin to change, right? And I am a quasi-government agency. Yesterday, I began to take my own staff through why are we centering equity and justice and DLL. I took them through the exercises that the community went through our DLL pilots to begin to break down understanding and misconceptions, right? So part of it is like, yes, fight against the system. And how do we create systems that are much more responsive and understanding to the needs of our communities, our children, and our families? Right, because if we can't disrupt the internal systems at play, then we're always gonna that's the key, right? The states, how do we really co-create if the system itself doesn't know what co-creation is? That's just not how they operate. Like, on any given day, give me $4.4 billion, but you're putting $4.4 billion in a system that is designed to do what it does now. Does that make sense, y'all? Like, it's in some spaces you would say that it's disparate by design. It's inequitable by design. So how do we begin to have those honest conversations with state leaders and understand that it also takes us who are working within state systems to change our habits of practice and understanding about what this means? And it's going to be hard. It's hard work to change a system that was built for a certain purpose, with a certain outcome, to be siloed, right?
Thank you, Jackie. I'll move on to the fourth question. How can state systems and policymakers create an infrastructure and system to support, system of support that holds them accountable to this vision of whole child systems?
I promise you I wasn't trying to tee that up. I feel like I've talked a lot, so I'll let one of my colleagues go first. And
it's like, it's exactly to what you said. One, the system works exactly as it's meant to. And it is like, if we throw more money at it, it's throwing money to the same thing. I think though, as you were talking, as we're so lucky to have you in your position as an insider, we have people who are, who are leaving the advocate side or the private nonprofit side or whatever, and going in within. And that's how we're changing the culture and changing the viewpoints, because they know what it looks like from the outside and they know what has to happen on the inside. It's not so easy to change, and that's hard. But when we get these insider, I don't know what you call, what is someone who's who can disrupt on the inside? So if we just keep building up people who can do that and who are willing to do that, I think that's how it'll be very slow, but it's how we can shift how, in this case, government works. And so then shift how we're thinking about that whole child, so that, as Mayra says, as you think about a family, and Mayra has a baby and I have a teenager, and you just think about your day and all the things in our world that you have to think about. Like, we're all lucky to wake up this morning grumpy in a cold, maybe, or warm house, but you had shelter and you fed yourself or your child, and if you have to take them to school, you got in a car perhaps that you're lucky to have, and you had money for gas to get them there and roads to get them there safely, and to return or go to wherever you had to next. And when they come home, they'll, have food in your cabinet for an after school snack, and food to prepare for dinner, and the lights will come on because it's going to be dark really soon, and just all those things. And so none of that is siloed, but okay, you get this for this part of a child's life, and in a department, in one particular department, for this part of a child's life, in this different department. So as we have whole child and whole family thinkers entering the departments, and then that's slow, but I think that's how we get to dismantle the system as we know it and rebuild it as we need it to be.
It takes champions from within and from grassroots efforts. And it takes opportunities such as this that we have here, these water cooler opportunities, to really inform what is taking place and what the needs are, and what is it that we need to do. So these are great opportunities, and I think we should continue to provide these opportunities.
Absolutely. And I think, to the points that have just been said about champions within, or people that are disrupting from within, I am encouraged. I'm encouraged by, the leadership of folks that we have seen be placed in positions of influence and power, right? As far as how they can use that power to improve these systems that have not been serving families the way we need them to, or worse, have been mistreating them as a result of how the systems are set up. So big ups to Jackie, right? Big ups to Kim Johnson at CDSS, and our Secretary Galley, who has been in this work. And again, though, these systems have baked in systemic racism and white supremacy since their inception. So it's also keeping tabs on the changes that we want to see and working together to monitor, the progress that is made. Yes, progress can be slow, right? The moral arc of the universe is long, but it bends towards justice, right? Like, yes, it's a little too long sometimes, but we have to keep pushing. And I think as part of that, I want to appreciate this opportunity to say, we're part of the Whole Child Equity Partnership that Keisha is a part of, that many organizations that are part of this conversation today, including Catalyst California, are a part of, that seeks to really intentionally build a multiracial, multi-sector coalition of organizations that are striving for shared goals to improve how systems respond to the needs of our young children. And it's not like rocket science, right? We know that there are multiple coalitions in California that are doing this work. How can we align our efforts more effectively in order to advance those shared goals? And it's hard work, right? Coalitions require resources, time, staffing, that organizations often led by people of color have less and less of. So it's not only monitoring state agency work, but building in the capacity and power of organizations and the community leaders they work with to do that monitoring and to keep that advocacy up. We're all part of these systems that were intended to be improved. But again, I will tell you, it is very hard work to be a part of these coalitions, and I'm grateful to be in it with folks like Keisha and others that are part of this effort with us. And then part of that work, I will have to give credit to Catalyst California and their whole child equity tool that just was enacted, right? AB 2832, that we're putting a lot of eggs in that basket about how we're going to use that tool to ensure that we're allocating resources to those communities that have been hardest hit by systemic racism, by anti-Black racism, so that the resources that have been going for early childhood are actually reaching the communities that need them the most. But that is a way to chip away at the systemic racism that is baked into these systems, right? Sometimes it's not creating a brand new program, but actually making long-term changes to programs that have been in existence and how resources are distributed, how the program is set up. And again, finding these champions that are willing to work with advocates and listen to advocates, create these stakeholder groups that can present the voices that need to be heard is part of that process. I will, where Keisha started last time, I am an eternal optimist. And I'm gonna hold on to that for as long as possible because my baby is 15 months old. And I have all the resources in the world. And these 15 months have been so hard to really figure out, am I doing it right? Am I supporting her in the way I'm supposed to? Am I supposed to be in this center, or am I supposed to take her to this activity? So I can only imagine, with all the privilege and resources I have, how other families are dealing. So to think that I don't have to do that alone, that I can work with fellow organizations and leaders and learn from the leadership of families that have done this for far longer than I have, let the ancestors be with me, I'm grateful for that. And this is just the start of that conversation.
I think in addition to what you were saying, Mayra, about monitoring, and Keisha also about monitoring, it's also holding systems accountable, right? So holding them accountable to move forward in the direction that the programs or funding or changes are supposed to be going in the direction that they're going. What's going to happen if they don't? Holding systems accountable. There are children's lives are at stake here. Families are at stake here. Our community is at stake here. There's no more time to peddle all of these ideas and to peddle all of these new notions. We need action now, and we need accountability now. Bottom line.
Yeah, no, and I would say, as the state agency person, is please do. I know Keisha got some heat by calling us, but it also spurred us into action. And I've had lots of conversation being inside in the system to unpack that, right? I'm going to cry about what you made us do in a good, positive way, in a healing way, because these are tears of joy and healing, right? Like, people think, I don't want to feel the things, but I think the system itself has to feel the pain and the hurt to understand that the system is racist. It's okay, but I'm not saying you are, but really, do we want to perpetuate systemic injustices? That's the core question about the urgency of now, right? And we also have to remember, and I think from the statewide lens, there are a lot of rural communities don't have the urban voices of advocates that other places do. How do we lift up and protect them? Because I think about some of those state of Jefferson counties, right? I will not name them, and the things I've been hearing, and that people are afraid of losing their jobs or even their lives, like really physically threatened. How do we, as we hold the public systems accountable at that local level, what do we do for those communities? Our communities, not even want to say those, right? That they're not these only urban centers, but I have the opportunity, the privilege to see that statewide and hear those stories. And some of them, those stories are heartbreaking, right? Because then you wonder what will happen if we don't put more effort into organizing there, into supporting families in a systemic way, right? That the state doesn't come in and say, we will do this, because it's right and it's just.
I think that going back to Mayra being, having a 15-month-old is hard. And now I have one child who's 14 and a half, who's about to be 14 and a half. She doesn't count the half, but I will anymore. Doesn't have half birthdays anymore. And to what Jackie just said, and Noemi, is that like holding the system accountable, being willing to call it out as it is, and being able to hold ourselves to call it out as it is, not to always lean so heavily into the word equity, because that's a word of comfort, and to lean more into calling it racism or racist or anti-racist as it really is, when it is. But also to realize all of, like, for ourselves as people of color here, what we have to do to shed the white supremacist values that we still hold dear. And I just, like, Mayra, I heard that in your, like, when you're so scared about which center to put your child in and stuff. And I want to say, oh, that's the white folk talking. It really is. And when I'm I'm only a parent of one, so I've only been a parent for 14 years. Of all the things I'm concerned about in high school, and I catch myself, oh wait, no, she doesn't. That's like the pressures we put on ourselves. And as we unpack that, personally, it helps us be stronger in unpacking that in our work and helping ourselves as people who aren't white, and support others who aren't white do that, so that we can, together with our white partners, unbuild this white supremacist structure that everything is built on.
I just have to really appreciate you for saying that, Keisha, because I feel like I have the best center because my mom is here at my house, right? Mm-hmm. And my mom is taking care of her and singing the Spanish songs and dancing, and my mother has more energy than I will ever have, right? And yet the mainstream, the white supremacist notion of what I'm supposed to be doing does not give value to my mama's love as the best teacher my child will ever have, right? And I am in this work every day. So how do I use this position of privilege and power to uplift that matters, that has value? And how can I be a better partner in our shared fight to make sure that the Black mamas and grandmas that are doing the same, or the Vietnamese mamas, right? Or whoever it may, the indigenous families that are doing the same. And again, not only validating the experiences that these women, these leaders have, but also finding ways for our system to embrace it and value it and uplift it. So that's the task that's ahead of us. And I'm grateful to be in it with you.
Thank you, Mayra. And thank you to our esteemed panelists for sharing your insights and experience with all of us this afternoon. It's impressive to hear how some of the critical elements that you shared that are necessary to design quality whole child systems that are rooted in equity and community power include centering around the experience of those most impacted by the systemic, racist, conditions. I also heard that it's about identifying like those cultural keepers to really lead the way. Mayra, I really appreciate when you spoke to like not just the co-design, but the workforce that needs to be embedded to really, so that it's really aligned to what those expertise. As you explore the topic of systems and the vision, that is, I see it being reflected in Jackie, when you shared about the blending and braiding of resources, so that, and that we're intentional about breaking down those silos. You also shared a range of strategies to work in partnership with communities that include being intentional about engaging, again, with those that have been most marginalized, like Keisha's, your example of expecting local and state entities to, I would just engage, like, to partner, to truly partner with Black parents and caregivers so that they are informing and overseeing how these policies are being implemented. And lastly, in order for systems to be accountable, accessible, of quality, aligned, and sustainable, we need to really ensure that these systems are really there to support the children that they're meant to support. And I'm hearing like maybe seeing what's working, redesigning and making changes when it's not. And I think part of what we constantly explore is, where does this discomfort come from? Because it is uncomfortable, but it's necessary. And it takes risks, but it's necessary because our children need us to step into that leadership. So once again, thank you to our panelists. We're gonna have a link on Slido for our audience. We'd love to hear from you. Please access the link and post on the chat to share your feedback.